Let's talk a little anemia. Iron deficiency anemia being the most common type of anemia you're going to see in pregnancy, especially. So if you think about it, if you don't have enough healthy red blood cells circulating in the system, you're going to have a decrease in that O2 carrying capacity of the blood. And so with that, the heart is going to try and compensate and increase cardiac output. So you're increasing that workload of the heart. So that's not a good thing. We don't want the heart to have to work harder than it already does. But some other things. So what do you think you're going to see in the mom who has an anemia, especially iron deficiency anemia? So that mom is going to be tired. She's probably going to be pretty pale, lethargic. She might complain of a headache. They can have inflamed lips and tongue when they have this anemia. Pica. If you've ever heard of pica, it's where people crave really non-food things. A lot of times it's ice chips is a common one. Patients will even crave and eat clay, dirt. I actually had a patient one time who kept hiding something under her bed, and I was starting to get a little nervous. I couldn't figure out what she had hiding underneath there, and finally came to discover she was very anemic. But she was hiding a can of cornstarch underneath her sheets that she was eating by the spoonfuls. Not my type of diet, but it's just something that they crave because the body is craving that it needs something, and that's what it triggers in the brain. So they can have that, and that's called pica. These patients are also, so if you have a decrease in O2 carrying capacity of the blood, you're going to have increase in wound infections and things like that, poor healing. You can ultimately have cardiac failure in these patients. On the fetal side of it, so when you're thinking of a pregnant mom, anemia is associated with preterm labor, preterm birth, low birth weight of the baby, developmental delays in the newborn, and then fetally they can have a decrease in oxygen supply. So if you think of those fetal heart tones that we're watching on the monitor, when you have a decrease in fetal oxygen supply, you're going to see those alterations in the fetal monitor. You're going to see maybe decreased variability, so maybe some minimal variability. You may start to see some decelerations, late decels, and things like that due to that decrease in oxygen supply. Why does this happen? So there's several reasons why it could happen, possibly. Every patient's a little bit different. Sometimes some patients just have low initial stores of iron going into the pregnancy for whatever reason. Sometimes it's hereditary. Nutrition plays a large role in it. So depending on their dietary intake, that can alter this level also. Hemolysis and then also blood loss definitely contributes to this. So think of these things, in relation to your patients and, what effect it has on the mom, what signs and symptoms she's going to complain of, what things you're going to see in that fetus or that newborn, okay? What levels, when we look at, talk about lab values, when it comes to anemia, your normal hemoglobin level, depending on your lab, is usually around 12 to 15. When we start diagnosing with anemia during pregnancy, usually anything less than 10.5 or 11. And then we also look at the ferritin level. Ferritin level looks at what the iron reserves are that the body has. Okay, so it's a protein that carries iron. So anything less than 12 is going to be something that we really want to definitely look into. Okay. So what are we going to do about it? If we diagnose anemia, especially iron deficiency anemia, what are we going to do about it? So supplemental iron definitely is probably going to be a key factor. When you want to be careful just prescribing supplemental iron to your patients because, if they're not educated well on it, they're probably not going to continue to take it because they're going to have bad effects. I guess my dog wants to be in the video back there. But anyway, so we need to educate them so they will continue to take these so they don't have these, detrimental effects that anemia can cause. So Iron technically is best absorbed on an empty stomach, okay? But it usually causes GI upset in your patients. So the first time they get GI upset, they're probably not going to continue to take it. So that's not going to be real reliable. So we need to educate them that you can take it with food so that it does not cause that GI upset, so that they will continue to take it. It is going to decrease absorption. We have to be cautious with what types of foods we tell them to take it with. So we definitely don't want them to take it with cereal, eggs, milk, those type of things. I'd make sure you're aware of that, okay? Because those are going to really decrease the absorption. So now we're taking it with food. We're also taking it with types of foods that add in a decrease in absorption, okay? So milk would be a bad thing. What could increase absorption and aid in absorption of the iron is to take with some vitamin C. So a glass of orange juice, something with a large amount of vitamin C, will help increase that absorption. Okay, so that's your supplemental iron. And then we want to change their dietary intake. So nutrition plays a big role. So increasing those foods that are high in iron, organ meats, meats, leafy vegetables, beans, things like that. Okay, and let them know that their stools, when they do have bowel movements, they're probably going to be dark green or black. Okay, that's normal. It can cause some constipation, so we may need to also prescribe them a stool softener. We're really making sure that their nutrition is good, increase water intake, and things like that. And then just one other side note, so that was mostly iron deficiency anemia. Another type of anemia that does occur in pregnancy, folic acid anemia. This is something we look at. It's going to have the same effects as iron deficiency anemia. You're going to see a lot of the same things. However, this is more important to take and make sure your folic acid levels are high enough prior to pregnancy, so prior to even getting pregnant, and in those early first few weeks of pregnancy when things are really developing and forming, especially with the spinal cord, because a decrease in folic acid, so having folic acid anemia, can cause neural tube defects. It's a big risk. I'd make sure you know that too. Okay? Take care.